I'm Taylor Duncan, and today I'm going to be demonstrating how to do a central line dressing change. So the first thing that I'm going to do is perform hand hygiene and introduce myself to the patient. Hi, I'm Taylor. I'm going to be your nurse today. Can you please confirm your name and your date of birth for me? Perfect. Okay, so today we're going to be performing a central line dressing change. I'm going to make sure that I provide the patient with privacy as well. And then I either need you to turn your head away while I'm doing the dressing change, or I can provide you with a mask. Since I only have one mask, the patient is just going to turn their head away while I'm performing the dressing change. So I'm going to go ahead and put on my mask, and then we are going to take off the old dressing. So I'm going to start by using my non-dominant hand, and I'm just going to secure that catheter. And we're going to start by pulling up the corners of the old dressing. And I want to do that parallel with the skin. And they get pretty sticky, so just ensuring that the patient's doing okay, making sure that their head is staying turned away while you're doing the dressing change, and then securing that catheter with the non-dominant hand. So once that's off, I'm going to go ahead and remove my gloves and perform hand hygiene again. And then I'm going to go ahead and grab my sterile kit that I'm going to be doing the dressing change with. And go ahead and grab my gloves that are right on top. Maybe. Okay, and I'm just gonna slide that off. Okay, then I'm gonna grab the CHG, and I've used this already. You just press those two and you hear a little pop, and that sponge part is gonna become fully saturated. And then we just wanna take a look at the skin surrounding the area. Want to make sure there's no swelling, redness, tenderness, and we also want to ask the patient as well. So are you having any tenderness in this area? No? Okay, perfect. So then we can go ahead and start cleaning. What we're going to do, I'm going to lift up on the catheter so I can get around the skin, and we're just going to go in a back and forth motion, and we're only going to be cleaning the amount of skin where the dressing is going to be covering. And we're gonna do this for 30 seconds. So 20, 25, and 30. And then I'm gonna go ahead and clean my catheter, and I'm gonna clean all 4 sides, and I'm just going up one side and the other. I'm not going to be going back and forth. Okay, perfect. So once that's done, I'm going to toss that, and then I'm going to go ahead and I'm going to grab my Tegaderm. And we want to make sure that before you apply the new dressing that the area of the skin is completely dry. So we're just going to kind of wait until it's dry. And then once it's dry, we're going to go ahead and put the new dressing on. And then I'm going to go ahead and grab this part, and I'm going to initial, date, and time. And normally, to keep sterile, I would have had my pen sitting on the table already, not in my scrub top, but I forgot about that part. So I need to have my pen sitting up on the table so I can initial date and time that new dressing. And then I'm gonna go ahead and remove my gloves, my mask, and perform hand hygiene one more time. And then I'm gonna go ahead and clean up my area, make sure that my patient is comfortable in a comfortable position, and then I'm gonna go ahead and document this dressing change.